Good evening, ladies and gentlemen. To tonight's report, we will be bringing you some exciting news in the field of neuroscience. Scientists at the Scripps Research Institute have reported successful preclinical tests for a new vaccine against heroin. Now, before we get into the details of the test, let's just look at some facts about heroin addiction. It is estimated that heroin addiction affects more than 10 million people worldwide. About 150,000 emergency room visits each year are due to heroin addiction, or in some involved heroin use, equaling about 14% of all ER visits. The average addict will spend about $150 to $200 a day to maintain their habit, while many may spend more. Injecting the drug can create a risk of AIDS, hepatitis, and other diseases caused by infected needles. It is estimated that 23% of individuals who use heroin become dependent on it. Now, those are some scary facts about heroin addiction. Let's see what's has been used in the past and is being used now to combat this addiction. Some of the previous forms of treatment included, in the 1960s, the popular treatment was to lock addicts up into prison camps, essentially taking away their ability to use heroin. Later on, methadone was found to be an effective treatment option, but its use is limited because it is only available through specialized treatment clinics. Two other drugs have been used to effectively treat heroin addiction, but they're still not the best solutions. Now, let's get to the results of this new lab test. Now, the scientists at Scripps Research Institute of Technology have reported successful preclinical tests on a new vaccine against heroin. The vaccine targets heroin and its psychoactive breakdown products in the bloodstream, preventing them from reaching the brain. George F. Koob, chair of TSRI's addiction research group, has stated that heroin-addicted rats deprived of the drug will normally resume using it compulsively if they regain access. But our vaccine stops this from happening. If the vaccine ends up working on human trials, it could become a standard part of the therapy for heroin addiction. Now, there were some challenges when developing the drug. First of all, designing an effective drug against heroin, effective vaccine against heroin has been particularly challenging because the drug breaks down so rapidly after injection. TSRI professor Kim Jana states that heroin is metabolized very quickly to another compound which crosses into the brain and accounts for much of heroin's effect. Jen and his team therefore designed the heroin vaccine to elicit antibodies against not only heroin, but also the other compound resulting from the metabolization of heroin. So, during this lab test, many tests were performed in order to determine the effectiveness of the drug. Initial tests showed that the vaccine could block some of the acute effects of heroin, such as obstructing pain. In this new study, the vaccine was put through more rigorous tests. The vaccine was given to rats that had already been exposed to heroin, much like you would find a human that is addicted to heroin. In one test, the rats had become severely addicted to the heroin and were taking it compulsively in escalating amounts. They were forced to abstain for 30 days and before giving renewed access. In the rats that received the dummy vaccine, intake resumed and they re-escalated, taking the drug compulsively. But if in the heroin-vaccinated rats, intake failed to escalate and the compulsive drug taking did not redevelop. Overall, the results of this test, the researchers confirmed that the vaccine was able to isolate the heroin in the bloodstream, keeping it out of the brain. The vaccine did not block the effects of the other drugs commonly used in addiction therapy, so it can be used in conjunction with these other drugs. Jan is now actively seeking pharmaceutical company partnered to sponsor these clinical trials, assuming that they go well, to eventually market the vaccine, which is good news for heroin users, because as we've seen before, the effects of this addiction can be severely debilitating.